Hello and welcome to part 2, Obamacare, what it does and how it has helped. Here we're going to talk about the goals and main provisions for the Affordable Care Act, as well as how well it has fulfilled those objectives. So we're going to talk about the coverage model, improvements to quality of service, and cost containment, both in terms of how well it sustained itself as a program, as well as for keeping a lid on overall premium costs. So let's talk about coverage. Existing coverage model we talked about, where we have primarily employers who offer health insurance for employees. Other people are under the Medicaid and Medicare program, and a small percentage get their insurance elsewhere. So Obamacare fits within that existing framework. So it first targets employers. So larger employers are basically mandated to offer health insurance to their employees, and if they're a small business, there are a series of tax credits that will help pay for the premiums that those employers are offering to those employees. So again, within the same system, if people are not covered under either of those options, then they can go to a marketplace where they can get access to different health insurance plans. Now, once you do that, you will get a subsidy based upon your income, and those subsidies will either kick you into the Medicaid program, where you're going to get basically those plans for much reduced cost, or you would not be in Medicaid, but you would nevertheless get a series of tax breaks. And those breaks affect people up to 4 times the poverty level. So a significant number of Americans can benefit from the subsidies that are offered there as compared to what they would otherwise get. So that's the broad coverage model, and there are some other provisions that are key here for access, the meaningful access. So people who have pre-existing conditions can still get health care for those conditions, didn't used to exist, and young people can be under their parents' plans rather than having to get one on their own, which is significant because their parents will often have a better plan than they would otherwise be able to get. So that's the coverage model. Second, quality of care. So a big change has to do with the mandates around what constitutes the kind of plan that's acceptable under the program. So it's not enough to just have a basic catastrophic healthcare plan. The intent is to have a plan including a lot of preventative services and many other services that are available to people. And the idea is that by emphasizing preventative care, it will, over time, reduce overall costs because we're going to try to make ourselves healthier and reduce the likelihood of having a more significant complication and health issue later in life. So that's fundamentally how quality of service has been improved. And finally, around mechanisms to control costs and sustain the program. So Obamacare has some mechanisms that keep it sustainable. And this is important because things like the subsidies needed for the expansion of Medicaid and the tax credits that people get under the program cost money. And we need to be able to sustain that through other revenue means. So one of those means is a series of taxes targeting wealthy folks. Second one, and this is very controversial, but the idea is that there is a penalty for people who don't get health insurance. And the idea here is that they're trying to push people who otherwise feel they don't need health insurance, people who are younger, healthier, into having some kind of insurance. And by doing this, it helps balance the cost between the entire population rather than only having people who are sick and older having that insurance. So that's a key area. Now, as far as the mechanisms for controlling costs on premiums, there are several ways that this is done. First of all, there is a mandate that only up to 20% of the administrative costs can be passed along to the consumers. So if we have administrative costs exceeding that, then the providers are going to just have to eat that difference. Secondly, the emphasis on preventative care, as we discussed, is intended to, over time, keep a lid on the premiums. So the idea being that because we're not going to have more sick people, that overall population would, over time, would get smaller, that it will bring down the costs, or at least keep them better contained. So another area in controlling premiums is that the costs for people who are older and sicker cannot be more than 3 times the level of people who are younger and healthier. And the idea here is that the healthier population is much larger, and we can have a slight increase on that side to help balance against an exorbitant increase for people who are sicker and who need that kind of help. So that's pretty much how the Affordable Care Act balances costs within the provisions. There are also other areas for innovation where it's possible to try to create systemic changes and pilot different programs, but I'm not going to get into the details about those. So how well has Obamacare been effective? One huge benefit is that there are way fewer uninsured people in this country compared to before. By most estimates, roughly 25 million people are now insured who otherwise wouldn't be without the program. And now the percentage of the population who is uninsured is down to less than 10%. So really, who's left? First, it's for some poor people who are in states that opted out of the Medicaid expansion. There were a number of Republican states and their governors said, no, we don't want to have this federal program here. And so they weren't given the opportunity to sign up for the program. The second one would be around people who chose the tax penalty rather than sign up for the program. And that's certainly possible. For some people, it's possible that the penalty would be less than the cost of the premiums, and they made that choice. The third group would be around undocumented immigrants. So illegal aliens are not allowed to benefit from the Medicaid subsidies, for example, and so they would not be included under the program. And the last group are people who are under hardship exemption. These aren't people where the program is unavailable to them, but they may have opted out because they had some special circumstances. So all in all, we pretty much have covered everybody. And if we had full Medicaid expansion, it really would cover fundamentally everybody in this country. Now let's turn to the area around costs. Now this area is a lot more mixed than the one around the coverage model. Here, we've seen that compared to the expectation for the Affordable Care Act, costs have been much, much more contained. In the past, there were projections that showed overall healthcare costs in this country were going to just skyrocket as soon as the program was in effect. And that has not happened. So we certainly have seen an increase at a much slower rate than was expected there. And in fact, what we've seen is that in the last few years since the Obamacare has gone into full effect, the rate of increase has gone up a little bit more than in the years just prior. So we're talking about a couple percentage points, but there's certainly some difference right there. But it's certainly not that dramatic, and projections are showing that that rate of increase is going to pretty much stabilize. It's not going to be increasing at a higher rate, down the road. And then finally, premium costs. For the first 2 years, the increases for premiums under the Obamacare program rose an average of about 7.5%. So that applies to 2014 and 2015. What we're seeing now, however, is that going forward into 2017, the increase is likely to rise dramatically. Estimates have risen as high as 25%, and what we're seeing are fewer providers who are going to participate in the marketplaces. This is a very serious issue, and is actually one that we're going to be covering more in part 3 of this video series. So now let's take a look at part 3, which will talk about why so many people want to repeal Obamacare and look at it from the perspective of folks who really don't like this law and why.